Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bio.
We'll claim your life.
Picture this. You're at a family gathering when your cousin mentions she just tested positive for the BRCA gene. Your aunt chimes in about how everyone on mom's side seems to get cancer young. Suddenly, you're wondering, what does this mean for me? Should I be getting tested too? You've seen those DNA kits advertised everywhere, but is that the same thing? And who do you even talk to about this stuff? Your regular doctor, a specialist you've never heard of? Sound familiar? With genetic testing becoming more mainstream and family health stories coming up in everyday conversations, more people than ever are wondering about their own genetic risk. But navigating this world can feel overwhelming when you don't know where to start or what questions to ask. If you're new here and you've just landed on this episode, welcome. I'm Dr. Bio, your health advocate. As a practicing family medicine physician here in Reno, Nevada, I take what I see every day in my clinic and bring those real-world insights to my work on the news, on social media, when I'm traveling around the country speaking, and right here to this podcast. Now, I'm particularly excited about today's conversation because I know just how important it is to demystify genetics, to help people truly understand when and how genetic testing might benefit both them and their families. That's exactly why we have the perfect guide for this journey, Dina Goldberg. Dina has her master's degree and is a board-certified genetic counselor, content creator, and the founder of Dina DNA. As the most followed genetic counselor on social media, she used to work at UCSF as the endowed counselor of hereditary gastrointestinal cancer prevention. And now she runs her own virtual private practice. Dina brings both professional expertise and personal experience to her work. As a sibling of someone with a chromosome abnormality, a fertility and IVF patient, and a new mom living with chronic illness, Dina, welcome to the show.
Oh, what an intro. I love that. Thank you for having me. I'm very excited to be here.
Well, I am excited to have you here. We're going to start off with a favorite for the show, which is a couple of rapid fire questions. So you just tell me what comes to mind. Okay. What's your go-to drink at a coffee shop?
Usually an iced oat milk latte with no sweetener unless I'm in the mood, then maybe a little sweetener.
Oh, I love a good latte. What's your favorite way to unwind after a long day?
Ooh, I love listening to Audible to a fantasy book. So it can't be anything close to reality and doing a craft at the same time after the baby goes to bed.
And what is it about fantasy that you love?
I just love magic and things. I'm in a science mind all day. So sometimes I like to escape that and just be in a world where things can't be real. And so it's not as stressful and it's more fun and there's more intrigue. So I love fantasy.
Oh, now you've inspired me to look at and listen to fantasy. So now you have another follower of that. Good note. What inspired you to become a genetics counselor?
Yeah, so I have a little sister who was born with a chromosome abnormality. When I was 6 years old, my parents sat us down and explained that. And my mom's also a pediatrician. So I've been interested in science my whole life and really in genetics. I wanted at one point to be an actress and singer, but then my science parents kind of pushed me towards the science direction. And now I'm able to work in the field of genetics and help families like mine or families that are dealing with something with their genetics, but also the creative entertainer is now there in my content creation part. My sister's the reason that I am a genetic counselor.
It's always interesting how so many things end up coalescing into one, like the evolution of the things we wanted to do or we thought we should be doing. And in the end, it does come together, even if it's in a different path. Thank you for sharing that. What's the biggest misconception people have about genetic testing?
I think the biggest one is that it's too expensive. And so that's a big part of my job is finding ways to make it affordable and working with laboratories to make it affordable. And the other misconception is that it's not valuable or that it can tell you more than it can actually tell you. So there's either too much weight placed on it or not enough value placed on it. And I like to kind of push people to the middle to understand what it can and cannot tell you and how valuable it truly is in care.
If you could get everyone to understand just one thing about genetics, what would it be?
I think that knowing about your genetics is going to be valuable for every single person at some point in their lives. And that there are people like me who are trained in helping you understand how that can be.
And what's one question you wish every patient would ask, but rarely do?
Yeah. Maybe I'm thinking like in the general health system, I would love if patients could ask, does knowing my history or given this history of A, B, and C put me at a higher risk for XYZ? And being able to understand their personal risk, basically. I don't think a lot of people ask about that. I think they assume that their providers are giving them all the information that's out there and that they don't know all of their options when it comes to preventative care.
Well, that's a great jump off.
Yeah.
When it comes to genetics, it's really hard to put the things together of what is an assumption, what is real, and what is the outcome. And I think having people understand what is a genetic counselor can be really helpful to start this conversation so people have some groundwork on what does that mean.
It's really hard to explain exactly what a genetic counselor does because it is a role that can span a lot of different areas in healthcare. So I'm going to do my best to really summarize it for you. All in all, a genetic counselor is somebody that helps you understand your risk of disease or helps you find an answer for why you developed disease. And then if you haven't developed it, someone who can help you understand how to either prevent it or lower the risk or what interventions you can take based on that. And we do this in a way that is appropriate and ethical and puts the patient in the best emotional outcome and also help people translate this information and communicate this information to family members because genetics, unlike other parts of healthcare, it affects the whole family, not just the patient sitting in front of us. All of those skills together are what genetic counselors do. We also really, our whole focus is on this ever changing and evolving field of genetics. And it is impossible to ask one care provider to be on top of all the things they're doing. If we were to take a primary care family medicine person, right? There's so many things you have to think about, and everything changes all the time. And then you add genetics on top of that, and it is impossible. And so the role of the genetic counselor is really there to be like the right hand of any healthcare provider, any healthcare team who can be as up to date as possible on modern uses and availability and the benefits and limitations to what genetic technology can really, how it can help in every specialty. And so that's my short answer. I also do want to just mention that there are genetic counselors that work in lots of different specialties. So we are embedded in the prenatal clinic, in IVF centers, in pediatric clinics when people are getting a diagnosis, and in cancer clinics. And more often in primary care, we're trying to get some sort of model for even genetics in primary care. There's also neuro clinics and cardiovascular and renal. And so in lots of different specialties, genetics can be really helpful. And whenever you're using genetics, having a genetic counselor is very helpful. We're that go-to person for our patients.
And in the lane, when you talked about that go to and how you are in different fields as far as IVF and pediatrics and so forth, a lot of people might be wondering, so if you're available in those specialties, what is the difference between seeing a genetics counselor in those specialties or seeing online where we see all of these genetic testing? I think that's a great question to compare as far as being in person. And what should people know about the genetic testing that's available online?
Yeah. So whenever we think of the word genetic test, it just means any test that's looking at our genetic material. But that is a huge umbrella of tests. There's so many technologies that we use to look at our genes and our DNA and our chromosomes. And we have to really know what we're looking for to know the best technology for it. So there's medical testing, which would be ordered by a healthcare provider through a healthcare setting. And that goes through a very specific workflow and uses very specific laboratories. And then there's the testing that a patient can order themselves. We call that direct to consumer testing. And that would be things like 23andMe, Ancestry DNA, and then some of the ancestry tests on the market. And those typically use a very different technology than what we would use in a medical setting. So they're very different tests looking at very different things. And so I used to tell people it's great for ancestry because the technology used in these direct to consumer tests that you order online That's great for looking at the bookmarks along our genes that tell us where our ancestors geographically came from. But it doesn't actually tell us about the function of our genes themselves. They're just bookmarks. And if we're doing medical testing and we're making healthcare decisions based on genetic testing, you want to sequence through the gene. You want to see if there's pieces missing or added. You want to understand if you have a variation that actually alters the function of the gene or not. And in order to do that, you really need a very different type of technology that, for the most part, is only available in the medical setting. Now, that being said, the whole landscape is changing a lot. And there are companies, it's called patient initiated testing, where you can order, but then you have a provider on their end look at things, sometimes even a genetic counselor, and the patient really just initiated but didn't directly order the test. And so that could be a medical test. Understanding the difference about the technology used, understanding if there's support there. If you're ordering an at-home test and there's nobody to walk you through any results, who knows how good the results are? Who knows how to interpret the results? There's so many different tests on the market, and you wouldn't want to just order a test because it's on sale, just like you wouldn't order a blood test that's on sale versus going to your doctor and saying, I'm feeling these symptoms, and the doctor actually ordering the correct test for you and those symptoms, right? You wouldn't just choose a random test. If you have a reason for doing it, then that's how you should select the test.
For everyone listening, with the fact that there's so many different types and the fact that you've been able to break it down into the two spaces where you have, of course, the technology piece where you can get all of this information, but in the end, what are you supposed to do with that, especially when you
Right.
don't know what that continuum or what that information means?
Yeah.
Versus in the other camp, in the medical camp, you can really go line by line and look at each gene. How does that impact you as an individual? How does that impact your future generations? And I
Right.
think those are the things that really make a difference when we look at utilizing that genetic counselor versus just having all of this data. And currently, there has been a lot of talk about cancer showing up at a younger age. Can you
Mhm.
walk us through why that kind of personalized genetic testing can make a difference, especially when you have someone like you to be able to help that person know their risk factors as well as for other family members?
Yeah. So what you're talking about is inherited risk for cancer, right? So when we think about cancer in general, we know that overall it's a disease of aging cells and it can really happen at any point, but most of the time it happens later in life. Now, there's a lot of things that can cause it. That can be things from the environment, that can be things from our lifestyle that increase our risk. But it can also be our genes, right? That put us at a higher risk. And sometimes it's a lot of genes that interact together with the environment. And sometimes it's one single gene change that greatly increases the risk for a cancer. Those are called hereditary cancer syndromes or inherited cancer syndromes. And that's what I specialize in. And so that only makes up about 10 to 15% of all cancers. But when we take people who are younger, we do tend to see a higher amount of them that will have one of these inherited cancer syndromes, which is the reason that they developed an early cancer. So whenever we see cancers, more than one cancers in the family, especially the same types of cancers, we see it at an earlier age, we see multiple cancers in one person, we're always a little bit suspicious that maybe there's a genetic change that could be causing these cancers in a family. And if that's the case, then can we test for it? And if we can and we find it, then we know who exactly in the family is at risk and who is not. And we also know what they're at risk for and what we can do to lower the risk or even in some cases prevent that cancer altogether. It's so important to know this information, but it's also pretty scary, right? For somebody who's young, who maybe has seen their relatives go through this, who maybe is a little bit nervous about knowing. When we talk about the genetic counseling part, right? Because there's genetic counseling and genetic testing, the counseling part is really understanding where the patient is in this journey, where they are in their life, how much anxiety they have, what their risk might be, looking at family history information, and putting all of this together to really understand if it's the best time to test, what tests they should be having, and they make up their mind. And then having a genetic counselor, when you have results, helps the patient walk through the results, what it means for that person sitting in front of them, how to communicate that with relatives, how to kind of get over these feelings, because there's lots of different feelings that may come up with a positive or even a negative result. and then how to incorporate that into your healthcare. And so by just doing a test online, if somebody does that, or even just with a provider that didn't provide the counseling, that can make people feel very lost. And we know that increases anxiety so much. That's the part of my job. One of the parts I really love and that feels very fulfilling is being able to walk people through this scary time, but give them the tools so that it's not as scary.
You hit on something when you have all this information, but you don't know what to do with it. And if it
Mhm.
seems scary, you may decide that you don't want to move forward with it when there
Right.
is an opportunity to learn more about what you could do or prevent. And it may not even be as scary as it seems, but without
Yeah.
that context, it can be hard to know. If someone is curious about how to get started with genetic testing, how should they do that?
Yeah. So there's a lot of times in your life that you would benefit from genetic testing. Whenever anyone is planning a pregnancy, everybody should have carrier screening. There used to be this thought that only certain ancestry groups should do it. No, that's out the window. We're not doing ancestry based carrier screening anymore. Everybody should get carrier screening because that will tell us if two partners or whoever's giving the egg and the sperm match on any conditions that they don't realize they carry, but then that can cause severe disability or even like deaths shortly after birth in their offspring. So that's something that everybody should have. And that's something that usually OBs will order. And then if there's anything that comes back that is confusing, then a person can go see a genetic counselor or they can see one before becoming pregnant if they'd like. But ideally, that carrier screening should be done before someone gets pregnant. And I always like to say both partners should do it so you have a better idea of both of your outcomes. But in many places, they're just doing one. And then if someone's positive, then they do the partner. To me, that causes more anxiety because then you're waiting for the partner's results. But anyway, that's the carrier screening that I think everybody should do. And I'm very adamant about that. Then there is testing when somebody's pregnant. They do something called NIPT, which is non invasive prenatal testing, or really it's a screen to look for very specific changes in chromosomes in the fetus when someone's pregnant. And that, again, typically does get ordered by the OB, and it's very routine these days. And then if something's abnormal, they may see a genetic counselor about that. And then go on to do a real diagnostic test because that's just a screen. Nobody should make decisions based off of that. And then there are, let's say after birth, there's anything abnormal about the medical history or something off about the baby or a child has developmental delay or intellectual disability or seizures. That's another point where genetic testing can be really helpful and beneficial and help us pinpoint the cause. And there are genetic counselors in the pediatric clinic that can look at that. And that's really like from pre-birth to teen years. And then I forgot to mention the embryo testing as well, which is another category. But then there's also as an adult who wants to understand your risks. So we talked about cancer. There's also inherited cardiovascular diseases. There are inherited forms of dementia and of some neurological things and of renal disease and of all these different things. Really, if you have a family history of something that feels like it's running in the family or that happened, like I said, at a younger age, and you are interested in understanding if that's genetic, that's where a genetic counselor or a medical geneticist can help you understand that. If that's something you're interested in, you can one, ask your doctor for a referral to a genetic counselor or to a genetics department, and it will depend on why you're going, and that will tell them where to refer you. And there are genetic counselors at most major medical centers, and there's telehealth genetic counselors and private practice genetic counselors. So there's lots of us out there, or you can self-refer. And so there's a website called findageneticcounselor.com where you can look up who is practicing near you. I have a telemedicine clinic, so I can see patients in certain states, and a lot of my colleagues have that too. So it's definitely available. I take all self referrals pretty much. I have some referrals, but it's very easy to self refer. So if you have any questions, we are here to help you understand if genetic testing can give you answers to your questions, and then understand what test to order and what will work best with your insurance or with your finances, and then walk you through results.
I love how you mentioned whether it's pre pregnancy or during pregnancy or even during pediatrics, you went through the whole lifespan, even
Yeah.
including as an individual. And on the show, we really love to empower patients to have the language to ask their doctor for that test. And I love how you gave some examples about asking, but if you could come up with a couple of phrases that would be really just the ability to connect with their doctor and say, I am interested in genetic testing. I would like to be tested for this. Could you think of anything that could be really helpful to bridge that gap? That
Mhm.
can really be powerful because sometimes we live in this power dynamic where
Yeah.
patients feel like it's hard to ask and they're just hoping that their clinician will recommend it. But if we can put the power back to the patient so they can
Oh, yeah.
also be able to ask for it, how powerful is it to know this preventative information and especially in the medical setting and
Yeah.
utilizing someone like you to unlayer what all of those pieces mean. So, what would you tell the
Yeah.
listeners of how they could do it?
Okay, well, we're totally on the same page. So a lot of my content actually on TikTok and Instagram used to be me giving people scripts to ask their doctors for certain genetic testing. And that would include using guidelines. So if there are national guidelines for who should qualify for testing, then and you present that to your doctor, then they have to listen because they're national guidelines, they're standard of care. And unfortunately, there's a lot of people out there who are not practicing the standard of care. And the only way for you to get those services and those resources is to ask for it. I know it's really hard for most people to just find guidelines, but if you can find guidelines for whatever it is that you're interested in testing for, that can be really helpful. The other thing is literally just saying, hey, can you refer me to a genetic counselor? I have questions about A, B, and C, or I'm concerned about my family history of ABC. I have this many relatives diagnosed. I want to understand my risk. Can you refer me to a genetic specialist? That's what you should ask. And if they say no, you can ask them why. Ask them why. I think I actually have one video that's like all the reasons doctors say no to a genetics referral. And it's like one of my most viral videos. But usually it's some like unconscious bias about it not being helpful or it being too much for the patient or something like that. You can ask them why. And finances should not be a concern because most of the time it's covered or there's financial aid available at almost every clinic. It shouldn't be a language thing because there's interpreters in every genetics clinic. It shouldn't be a medical literacy thing because that's the whole reason. Like, that's half our job is educating people at wherever they are and at whatever level of medical literacy they are at. There really isn't a good reason unless they may say, I don't think this is genetic or, oh, there's no gene for this. But here's the thing. There may be a gene for it. It may be a newer gene, or maybe that provider hasn't taken genetics, right? Because a lot of, yeah, as I'm sure you know, in medical school, a lot of providers are only given 2 weeks of genetics, and that's all genetics. And there's so many specialties within genetics that don't even get touched on. And then that changes every year. So just because a provider is not familiar with an option, a technology, a gene, doesn't mean it doesn't exist. If they say, I don't think it is, and you still have questions, then that's where maybe self referring or like finding a local clinic, calling in, telling them your concerns, that could be helpful too. I hate to tell people to bypass the referral, but that definitely happens.
We talked about the bias that can infiltrate care. And in the end, it's supposed to be about that patient, that
Yeah.
individual. It's
Mhm.
not supposed to be about your own personal bias of what you think that patient can afford, what they're interested in, what
Mhm.
genes you think that they could be more susceptible to. It should be about that patient. And that's why I love the fact that you have now given the listeners the power to be able to get that referral or get that information and also the steps to if they are told no, what else they can do because that's what this is about. It should be in the hands of the patient in the end when we talk about patient care.
I also want to add too, sometimes if somebody doesn't have a family history of something, then they may not qualify. But I can tell you from my personal clinic that there are so many people who don't truly know their family history or who are adopted, they're donor conceived. Their parent they thought was their father is not their father. There's so many things. Culturally, they don't talk about disease. Maybe their relatives didn't have good access to healthcare. There's so many reasons why the family history only approach to guidelines is really putting a lot of people at a disservice. Like in my clinic, for instance, anyone that walks through the door that wants testing gets tested because I have found that people that don't qualify often they will have something. And now they will qualify for services because they then got that testing, but they couldn't get in the door to get the testing because they didn't know their family history. This is a personal passion of mine is like you got to advocate for yourself. You got to push. If you don't know your family history or if you don't have a big family and they're telling you, well, you don't have enough people in your family to get this, push back And by the way, the cost of a genetic testing panel in the cancer setting is $250. So it's not thousands of dollars. And that is a good medical grade panel. And that's the majority of the laboratories that offer that. And in a lot of places, there's financial aid to make it zero. Even if you don't fit your insurance criteria, you can still get the testing. So it's another thing to just push for. You can say, can I have if they say this test isn't going to be covered by insurance, we can't do it, say, well, what's the cash pay rate? And usually it's not that much. And then if you fit criteria for financial aid, then the laboratory will just cover it for you.
And it's all about knowing those next steps. If someone
Mhm.
says no, well, what's the cash pay? If someone says
Yeah.
no, having that information so you can push back and advocate for yourself is key. And that's one
100%.
thing
Yeah.
I share with my patients, that do not take that no
Yeah.
as the ultimate one. There's other opportunities, there's other answers. And I also love that you mentioned these current guidelines are often associated with historical knowledge, and that
Mhm.
knowledge may not even include all genders, because we do know that women have not been included in clinical
Mhm.
trials and studies. And so that percentage of disease rate that is being socialized may not be accurate, because a specific group of the population, including women, may not have been part of that. So you really don't know what your risk factors are. Having the ability to get tested is vital. Here's a reality check. According to research in the Journal of Clinical Oncology, more than 4 out of 5 people who meet national guidelines for hereditary cancer testing have never been tested. This means they have family histories or other factors that medical experts say qualify them for testing, but they've never gotten it. Many people don't even know that genetic testing exists, or they think it's only for families with rare conditions. But genetic testing can actually help with lots of everyday health decisions, like planning a family, preventing cancer, or figuring out which medications work best for you. What are the biggest barriers you see preventing people from accessing genetic counseling and testing?
There are three that mostly come to mind, and they're the reason why I do what I do. So the biggest barrier that I have found in my career is awareness. So what you said earlier, most people are not aware that genetic counseling and genetic testing is available to them, and they're not aware of its value, right? And that it's affordable and it's accessible. And so awareness is the biggest barrier that I have found in both in my master's thesis research and in my time on social media and in my clinic. The second is the lack of understanding by referring providers of the value of genetics. And so I find myself often having to sell the value of genetic testing in general to some, not to everybody, but to a lot of providers. And a lot of times they don't really understand what it is I do until they've gone through the process. So I often will have a physician as a patient. And after they've gone through the process, they start referring me all their patients because that's when they're like, oh, that's what this is. Oh, this is incredibly valuable. Right. And so until they've talked to me and they've gone through this and they understand like that this service is something that exists. And then the third barrier I talked about earlier is this perception that genetic testing is not accessible or that it won't help somebody. And that's just not true. There's so many ways that the industry has made it accessible, that there's so many grants and funds and ways to really get more people tested. And it is not a luxury, service that only certain people have access to. This exists in all these clinics in rural areas. We're trying to get even more in, and lots of Medicaid patients. So it's really, I think that the biggest barriers are those things, just the knowledge, the underestimation of value, and the perception that it's not accessible.
When we talk about accessibility and awareness, we have to also talk about 23andMe. A lot of people know about it, they hear about it. So, what are your thoughts on it?
Yeah. Okay. With all of the negative press and all of the stuff that's gone along with the bankruptcy and the worrying about privacy and sharing of data, I can understand why there's a lot of hesitation to really go forward for a consumer on this type of test. But I will say that the technology and the service provision by Lemonade Health that they were using, I was an early user on this test and I was very impressed by it. I think that there's definitely potential for direct to consumer companies to become more of a patient initiated type of company where a patient gets a genetic test that's really looking at a broad range of things and then getting information back about that. But I actually would prefer this other type of testing that I think is going to be the norm, which is population screening. Yes, you can go to a company, you can request to have genetic tests done, but there are a number of healthcare systems now in this country that are allowing everybody that walks in the door the opportunity to do a big panel of genes for some of the most common inherited conditions. And to me, I think that is so great because that is removing these guidelines. It's removing the inequalities in who we offer testing to. It's allowing us to test more people of populations that were not tested as much. And it's giving us more information so that we can provide better care to these different communities. Not only that, but it's finding people that would never fit guidelines that now have all of these services available to them to really help them manage their health. And so that population screening, I'm pretty sure is going to be the future. I am hoping that one day everyone will get access to this testing at an early age so that they know what their risks are and can then go on and live their life in a way that works for their personalized risk assessment. Right.
And population health is what we're seeking when we talk about health. We're talking about preventative measures. We're talking about being able to intercept a disease or reduce a complication. And it has to be equitable to everyone. And
Yes.
I often talk about wellness and public health are two different things. And in this current climate, it's actually become very mixed and blurred lines where a lot of people don't understand the difference.
Yeah.
I love that you talked about population health because if you have a certain income, you can afford the supplement a
Yeah.
specific wellness journey. But that is not healthcare. That is not really being able to provide information that somebody and or everybody can use to
Right.
have the best health possible.
Right.
And so you talked about population health. We also talked about 23andMe. I think whether it's population health or any sort of medical genetics or this kind of direct to consumer, a lot of people are worried about what should I be concerned about when it comes to my data, my personal
Mhm.
information. We had in the news about things being deleted. Share with me what your thoughts are about that and what are some safety measures that people can do if they do decide to move forward.
Here's the thing. There have been people taking biological specimens for testing for decades, right? And it really wasn't as much of an issue until these companies were more public. And then it was genetics, which people feel, you can tell so much about somebody. And so you're going to be able to learn all this stuff about somebody, and they don't want that out there. But we're taking people's specimens all the time, and it really hasn't been this issue. And I know genetics really truly is a separate category because it does affect more than just the patient, it's the family too. I do think that there's a huge place for understanding privacy, but I will say that these medical testing companies have been doing this for so long. They have a lot of privacy in place. I think the thought of what happens when these things get acquired and sold, which does happen and it has happened, it's a scary thing. And I think that it's also really hard because I think that there's a lot of people that don't understand what this information truly is. And so the way I think about it is like your online footprint, your blueprint, your Facebook, your social media, when people Google you, that footprint online is sometimes more powerful than someone's genetic snips that were collected by something like 23andMe. We assume that our genetics, you can put them in a machine and you can get a picture of what someone looks like. But that's not, there's a lot of this like sci-fi types of thoughts here. There's still so much we have to learn about our genetics and about our genome and about how things affect the person as a whole, that I think that some of the scare, not all of it, but some of it was based on these ideals that this data is way more, or that we are more advanced in understanding this data than we actually are. Privacy is important in all areas of healthcare. It's important in genetics. It's important in these codes. There's laws in place to prevent genetic discrimination from health insurance and employers. So that's a big one we talk about all the time. But I have a hard time talking about that now with our current political climate because who knows? There's so much happening right now. Nobody can guarantee that those laws will stay in place. I think they will. They were signed by a Republican president, so it's most likely they're not going to be touched. That being said, it's crazy right now. And I think it's just like this case where this technology, this understanding and ethics behind the privacy of our own genetic data, the technology is ahead of our laws right now.
I want to also focus on the fact that you do have not only the expertise, but you also have a lived experience with
Mhm.
this. And I would love for people to know not only why you're so passionate about it, I can feel it even on this interview, but just sharing another layer to that passion.
Yeah. So I think to me, all of this public scare, the reason that it scares me is that the more people are scared, the less likely they are to participate in research, to give their data, to give their information. And then the less likely we are to find breakthroughs that really help people at large. And so I think that it's been a little bit overblown, and privacy is important, but also thinking about the benefits to participating in research and to giving data, and not to necessarily certain companies, but that understanding where your data is going whenever you give it to anybody is important, but also not to let that stop you and to really critically think through what is the negative, what could happen if I participated in this genetic study, let's say through a university. Those are very secure. I think talking to somebody who's enrolling you about what could happen and what wouldn't happen is, and then what the benefits are to being part of that. I think that's where my thoughts are, in that I just hope that it doesn't scare people away from contributing to science overall.
You have a personal tie into how genetic counseling it has really changed your outlook. If you feel comfortable talking about that.
I'd say that my personal experience has changed my outlook on genetic counseling and on how I provide care to my patients. I grew up with a sister who had a chromosome abnormality. She has something called ring 18. So it's a deletion of both ends of her 18th chromosome. We don't even know the breakpoints because it was 30 years ago that she was tested with the karyotype. She had intellectual disability, a lot of different physical issues. We were part of the Chromosome 18 Research and Registry Foundation growing up. I was a SIB, so I worked a lot with other siblings of people with special needs. And so I was really already in this community in one way. And then I ended up in the cancer space just because that's where my path took me, and started getting really involved in a lot of patient advocacy groups. I also, by the way, forgot to mention, I have had an undiagnosed chronic liver issue since I was 18 and have had so many procedures. I've navigated the healthcare system in so many ways as a patient. Like, I'm a professional patient. I have all these hacks from it. And then I had infertility and had 7 surgeries within 3 years, and then went through several rounds of IVF, and then finally got my baby. But after all of that, it was like, whoa, like I had way more experience being a patient than anyone should in their life already at 35. I'm so patient focused. And like when I hear things from my colleagues about what's good for the patient, and I don't really believe that's good for the patient, I'll want to unpack that and see, "Hey, why do we do these things? And why is our healthcare system set up this way? This is not good for the patient." And I think that's just because I've been the patient, I've been in their shoes. And I'm also really involved with an organization called the Breasties, which is for people affected by breast and gynecological cancer. I've done so much work with them, and with just seeing those patients, specializing in them in clinic, and seeing the way especially women are treated, like as you mentioned earlier, the stuff about women's pain, having had to go through stuff without anesthesia, then learning I could ask for anesthesia, and learning in other countries they anesthetize things that I didn't have anesthesia for. Like those types of things make me want to share that with others, and like, why? Ask the question why? Why do we do it that way? So I think that's why I'm so patient focused, is just that I've been there and I think it's bullshit.
And thank you for sharing your story because you've been there, you've been through all areas. And when we have worn the patient and the clinician side, it changes our entire perspective of
Yeah.
how our patients are navigating this fractured system. And so I am very grateful that you were willing to share that because that's where that passion I can see seeps through. And that's why you are patient focused. And I just wanted everybody to hear it. Thank you for just sharing that.
Yeah.
So, Dina, this has been such an enlightening conversation. I really appreciate how you make genetics accessible and actionable for people. I know our listeners will feel more confident about navigating genetic testing and understanding their options. For those who want to learn more from Dina, you can find her on social media. She's at Dina.dna on Instagram and Dina DNA on TikTok. If you're interested in genetic counseling services, you can visit malibugenetics.com/become a patient. And Dina has graciously offered to help people find genetic professionals in their area if you reach out to her. We'll have all the links in our show notes. Dina, anything else you want to add?
I do want to say to everyone that if you do have a genetic variant that puts you at risk for disease, it can be really scary, but it doesn't have to be as scary if you have somebody that is there as a resource, as an expert that's holding your hand and making sure you're getting the care that you need and just helping you along the way. So that's another reason to see a genetic counselor because we specialize in making that result less scary. So I don't want that to be a reason that you don't get tested.
And medicine isn't meant to do this alone. We are your person to help you through this. And that's the beauty of medical genetic counseling. We're not only getting the information, but what can you do with it? And that's what you bring home to
Yeah.
patients. And I love it.
Thank you.
Did something in this episode spark your curiosity about your own genetic health? Consider sharing this with someone you love. Because here's the thing, understanding your genetic risks isn't about living in fear of what might happen. It's about being empowered to make informed decisions about your health and potentially preventing disease before it starts. Knowledge is power, especially when it comes to your DNA. You've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.